New videos every day.
Okay, we're back here now. We're with Becky and Eric, and we're doing the first segment we talked about with Greg on the upper cross syndrome and headaches. So one of the things that I like to do with headache clients is to have them come out and try a Brugger test at first. So she's going to step here. Becky, just go ahead and face Eric there. And to do the Brugger test, what you want to do is place your hand on top of the forehead and then come in and palpate the suboccipitals with the index and the thumb. So as I'm palpating right now on Becky with my index finger and my thumb, I'm feeling for any kind of hypertonicity at the suboccipital region. And on Becky, I'm kind of feeling a little bit of tightness here on the left, and then she's got a little bitty boggy spot here on the right. So what we're going to do is have her sit down as I hold on to this. So she's going to sit down on the table, which is taking her out of gravity. And I'm still assessing the back of the head at the suboccipitals as she's doing this. And what I'm feeling is no change. So what does that mean? When there's no change in the tonicity of the muscles in the back of the neck, that means the transitional force is coming from the head down. So she still has there's something in the neck that is fixated and is not loosening up as she sat. If she was standing, go ahead and stand back up again. And let's say she was standing and she sat down and this got better. We would know there might be some kind of a pelvic dysfunction or a short leg or something like that coming from the ground up. Does that make sense to you guys? Good. So what we're going to do now is kind of look at an upper cross, other places in the body where this could be affecting a head-on neck problem. And Eric's going to talk a little bit about that. What do you see, Eric?
Right. Well, let's turn you sideways here and talk about a typical upper cross syndrome, which Becky does not have, which most of you have already seen. The shoulder girdle tends to roll forward on the rib cage, sometimes the scapula wing. It causes the neck to go forward on the thorax. See those Dowager humps? Sometimes, don't we? And as that comes forward, the neck starts to move forward and the head has to cock back through the OA joint, the occipital anal condyles, to level the eyes. So we've all talked about this. You've talked about this and studied this in school. So what happens is that causes compression, and a lot of headaches come from neurovascular compression here right under the posterior occipital anal membrane, which is the motor control center of the body. So even though Becky doesn't have this, we are going to demo an upper cross syndrome pattern, which means that we're going to try to correct the imbalances, typically tight pecs, weak scapular stabilizers, rhomboids, lower traps, stuff like that. And we want to make sure that the deep neck flexors get some tone and we get the sternocleidomastoid and stuff like that loose.
Okay, so now we're back here with Becky and we're going to demonstrate a couple of techniques for headaches. One that we like to do is for Dowager hump too, because a Dowager hump is going to be basically what's going to happen after your head's forward and your head cocks back. You're going to start to create a Dowager. So we like this technique called the flying V. It's one that Eric created a long time ago, and you take your non-dominant hand and place it on top of your dominant hand, just crossing over these two fingers. And we like to start right at the cervical thoracic junction, right, the base where this Dowager is going to start. So what I have Becky do as I do this, I come in with locked out arms, my chest and my posture is really good. I'm coming through the ground. I'm going to increase my pressure here at the cervical thoracic junction. She's going to lift her head up and tuck her chin. As she does that, I increase my pressure. When she relaxes, then I drag the groove. That's going to be causing those joints to do what? Close. We're trying to close these joints. So she's going to lift her head up. She tucks her chin. That stretches the suboccipitals and strengthens the long, deep neck flexors. And then she relaxes down. And then I drag that groove some more. Have her do it again. She comes up. This is also a retraining exercise. It's good for strengthening. And relax. Good, and you can do this a few times. You know, the idea is to get in here and to help use the bones as levers to release the muscles. And that's what we're trying to attempt. So here goes one more time. Lift up, tuck your chin, and relax. And then I'm going to increase my pressure and drag the groove one more time up and down and relax. Good. Now I'm going to show a shotgun technique, and your guys are going to like this one in your practice because it's easy and it's real effective. So I like to come in with my ulnar blade and my forearm. I like to lift up with a lot of pressure as Becky lifts her head and tucks her chin. Go ahead and lift up, Becky. She tucks her chin under. I'm going to drag that groove. She's going to come back down to the table. I'm increasing my pressure. I'm in the lamina groove. I'm dragging down. She lifts up and down. Lots of pressure here. Stay in the lamina groove. One more, up and down. And you can do this several times. Remember, this is a retraining exercise too. It's strengthening her erectors. It's strengthening her deep neck flexors. It's also stretching her suboccipitals. Good. One more time. Up and down. How's that feel, Becky? Really good.
You have to do that on both sides.
Yep, we'll do both sides.
Let's
do the other side real quick. I'm going to come up, hook, And then she lifts and tucks and relax. Good. This is a powerful, powerful technique. This is one of my favorites. Your clients are going to love this technique. Try it on everyone that comes in, unless they're flat backed. Now, if they're flat backed, we're going to have to be careful with that because that's called a dorsal dish, and we don't want to compress joints that are already stuck closed.
Let me talk about that.
Eric, go ahead and talk about that.
Yeah, because you'll see a lot of people, including, I think Paul and I both have this, and you'll see it on a lot of your clients where the people are flat between the shoulder blades. You do not want to be putting downward pressure. You see a lot of massage therapists, a lot of you guys are doing this kind of stuff, putting pressure down, and that causes more and more problems. Or you're getting in and fascia mashing things that you think are trigger points, knots, muscle knots, which in actuality are rib heads. And so you do not want to be pounding on those things if they are flat. Those joints have already closed, and you're just going to set off mechanoreceptive activity. It's going to cause more protective muscle guarding and more pain. So
why don't you show her that scapula technique for replacing that scapula?
Yeah, so Becky isn't too bad with this, but on a lot of your people, you're going to see those rounded shoulders that create a lot of rotator cuff problems, right? When those the internally rotated humeral heads start to come together like this, when they start to raise their arms, they get some supraspinatus tendonitis impingement or tendinosis impingement. We're going to put this scapula back where it belongs to get the shoulder blades back, get the shoulder girdle back up on the rib cage where it belongs. And so, as Ida Rolf, one of her famous quotes was, "Put it where it belongs and make it move." I'm coming under the anterior part of her shoulder here, and I'm kind of pulling on the front line, meaning the clavicular head of pec major and all that stuff on the front that we want to get hold of. Got our arm brace back here, and I'm putting this thing back where it belongs. Now,
and since I'm here, maybe I can help you with this one if you want me to.
Which one do you want to do? Go
I'll
ahead.
depress the scapula.
You go ahead and do
like.
that, and we'll do it in two pieces.
Two pieces?
One person obviously can do both of these, but go ahead. He's going to put it back where it belongs. He's going to put pressure here, notice how his body weight got nice. He's just leaning. It's just a leaning technique.
Mm-hmm. And then you can put the arm back where it wants to go. If you
do
want
it again,
to.
Paul. This time, just picture the subscapularis, what it's doing underneath here, compressing those ribs. So people who have that kyphotic curve, a little bit too much curve back here, this is a good way to flatten that,
Pull down right
curve
here.
out. So she's pulling down
and relax
toward the table, and then he puts it back up there and take some of that curve out of there. An addition to that that's really helpful is to come in under the anterior part of the shoulder and to bring the arm into a little bit of adduction across the body to the first restrictive barrier, and we're going to put it where it belongs and make it move again. So now I'm going to ask Becky to do to just basically just pull the elbow toward me. 2, 3, 4, 5. When she relaxes, I'm going to do both things. I'm pushing like this, so the technique looks like this. Ooh, she says. So it's this right here. It's really easy, and you got to add it to all of your techniques. Don't go in there and beat up the rhomboids and lower traps and get these shoulder stabilizers weak, because that'll just continue to cause the forward head posture caused by the shoulder girdle rolling forward on the rib cage. So we corrected this part of it. So we can go on and do some stuff on a couple more techniques on the front to help get the head back on the neck. We're going to continue with Becky by trying to make sure that she has some cervical curve. You hear chiropractors, orthopedists saying the person has a straight neck. Really, they don't have a straight neck. What they have is loss of cervical curve. So what I'm going to do is I'm going to put Becky's, usually when the person lies down like that, you can tell what their forward head posture is like. If their eyes should be looking straight up at the ceiling, they shouldn't be looking back. The chin should not be like this. That's what you're going to see in your practice, right? So let's correct that. These two techniques are going to correct this. So what I'm going to do is I'm going to put her head exactly where I want it. I'm going to put a little chin tuck in there, and then I'm going to come in like this with my hand. This is an old technique that I picked up from a 94-year-old working osteopath called a unilateral neck stretch. So there are two ways to do it. You can come in and come across like this, and I'm going to ask Becky to turn her head to the right. As she turns to the right, I'm just going to have her continue to slightly turn to the right as I strip up the lateral fascia. But really, I'm trying to see if there's any spring in the middle of the neck. I want to make sure that these cervical vertebra, C4-5, is supposed to be the apex of the cervical curve. And so I'm just going to strip up. How does that feel? Oh my goodness, whatever that means. And then the opposite way of doing that from this side is this right here. Come up on the forehead, get your body weight low, center of gravity low, keep your lumbar lordosis locked in, get comfortable, and then just sweep up the side of the neck like this. You can have them activated or whatever, but you don't have to. You can just strip right on up. Come all the way up that lateral fascia and get down into the thoracics. If they've got that Dowager's hump, get on down in there into the upper thoracics and try to push that. Just picture getting rid of that Dowager's hump. And in the follow-up retraining section, we're going to have Paul show you how to do some home retraining stuff for people who have Dowager's hump who need to work on them at home. Okay, so that you would do both sides, obviously, but that helps put the curve back in the cervical spine. Now, Paul's going to show you a very important technique, the OA joint technique.
Okay, so real quick here, let me just explain OA. Right here's our OA joint here, and it is a bowl kind of that sits on top of a concave shelf. So its job is to go ahead and slide back and forth in that bowl right here on the atlas. So what we're going to do is we're going to hold her head like it's in a bowl. So I'm going to hold underneath the top back of the head here. I'm going to place my other hand pinky side down above the eyebrows. What I like to do is lock out this arm here, my right arm, so I'm not bent and I'm not muscling this technique. And I come in here with my left hand, and as I stand up tall, I compress with my left and I pull out like I'm scooping with my right. So as I do that, I can really feel a lot of tightness in Becky's suboccipitals. Do you feel that?
Yes.
Now what I'm doing too, and you may note this, is I'm kind of cocking her head a little bit to the left. It's not only going to the left and side bending, but it's going right in rotation. When I do left side bending, right rotation, it now concentrates the force to the right suboccipital area. And that's where before I was feeling tightness, if you remember that from previously. So I'm coming in, I'm cupping there. I've got my hand a little bit off to the left on the forehead because I am going to side bend her left and rotate her a little bit to the right, affecting the right suboccipital. So go ahead and tuck with me and look down. If she tucks with me and looks down, it actually activates those deep neck flexors, which is important because eyes are motor control movers. So when they use their eyes, you can just come in with her and follow her. And she gets a nice tuck there with that. That's really good. And what I'm looking for is joint play back here. So if I spring it down, if I push a little bit and pull, I get a little joint play in there. That's good. That's what I'm looking for. And have her help so she can always be looking down. And that's a real simple technique, and you can do that bilaterally or unilaterally on one side or the other.
Check both sides.
Yeah, you should always check both sides.
Yeah. She happened to have her problem in suboccipitals on the right, so he was focusing on her problem, but always check both sides.
And this can be, yeah, like he said, it could be a unilateral, bilateral technique. Well, I think that's it, Eric, for that. And then we're going to come back later with another segment for some lower back techniques. Thanks for joining us. Yeah. And we'll talk to you later.